Hi. All right, this is our first time doing a live, so I don't really know what I'm doing. Let me see who's on. He'll be here in a minute. Hi, guys. Well, we're doing a live Q&A because we couldn't get to all of the questions last week. So we figured it might be better to do it this way so we can get to it. So if you have any questions, type them in. Should be coming. All right, I can start off with one of them that I remember. Someone had asked if you're going to be awake for the procedure, and you will be awake for the whole thing. Oh, look who decided to join us.
No.
I haven't had any questions yet, but
Okay.
I was going to say go off of some that I remember, which was if they were awake for the procedure. And you will be awake. That's why you'll be able to travel home after. But we numb you up with lidocaine cream for about an hour, and then I'll come in and do the lidocaine injection. So by the time he comes in to work his magic, you'll be completely numb. And we do offer Pronox, which is basically laughing gas.
Very safe. They use it in the dentist's office. So some guys have a little bit more anxiety than others, so that's always an option.
Yeah. Or if you just want to fly high for a little bit, which we've had some guys do.
What other questions did you have from previous that we weren't able to answer?
How do I see the chat if people are asking? Will it pop up right there?
It should.
Oh, how do I
Anybody
get rid
have
of
any
that?
questions? Send them in.
Yeah, send in your questions. What's another one?
Some guys ask if they're able to fly in and out the same day.
Oh, yeah. You can fly in and out the same day, as long as you plan to be at the office for about 4 hours. So we have a lot of guys that will fly in the morning, do the procedure, and then they'll fly home that night. Then we have some guys that make a vacation out of it, so they'll come in on a Friday and then stay through the weekend. But if you're out of town, then we just do all of the follow-up via text, and we have you send in pictures every 3 days so you can recover at home, so there's no need for you to stay here any longer. Oh, there. I can see. Sorry, this is our first time doing this, so how does the it's a learning curve. We're learning lots. How does financing work? We have
a couple of different financing companies that all you do is apply, and usually they'll get back to you within 24 to 48 hours. I think the lowest credit score on some of those is 510 or 520, so somewhere in there. And they give you 6 to 18 month options.
Yeah, so if you need financing options, then send us a message and we can send you the links, and then you can see if you qualify. And then you can do the payment plans through there.
And there was another question that was in there. What was it?
Any concerns if I keloid easily?
No.
No. We don't do any cutting, so there won't be any scarring. You'll be bruised for about a week or two, but other than that, you won't be at any risk for keloids.
Not at all.
Hi, brats. We love you. Do you perform suspensory ligament separation?
We do not.
We do not.
Here.
We don't do any surgeries here.
We do have people go for circumcisions. We do have a urologist that can do the circumcisions. in case guys are not circumcised. Then they can come over here within a couple of hours after that surgery and actually have it done at the same time.
Aw, Brandon, you guys are the best. Brandon, get back to work. I'm in Toronto. Shall I bring you new candidates? Heck yeah.
Heck yeah.
We love our Canadians.
Oh yeah. Our Canadians are some of our funnest.
Yeah.
In fact, that might be another podcast we might do is with a couple of our friends from Canada, and they have a pretty good podcast going, so
Yeah.
maybe we'll set that one up within the next week or so.
What the most sessions one person has done? Well, that's a good one.
The most sessions has been a guy that went 5 different sessions. He started roughly at about 5 inches and went all the way to 10 inches around. So we do not recommend that, however, kind of special circumstance. The wife had 7 children vaginally and a 9.5 inch dildo that she liked playing with, and he got a little competitive and went 10 inches around.
Yeah.
So I think the most that we usually recommend is 7 to 8 inches at max. Anything above that becomes very uncomfortable for most females.
Stretching devices after the procedure, yay or nay?
Yes, you can still use stretching devices after the procedure or before the procedure. You can still use pumps. We don't recommend using the pump while the filler is setting up, so we usually like to, after the procedure, we'll just leave it alone for the next 60 to 70 days to let that filler turn into your own collagen. But after that, you're able to use the pumps again, which will help actually stretch the skin so we can actually get more filler in there if you plan on doing 2 procedures. What was that question?
It says you two are awesome. What about jelqing?
Jelqing is perfectly okay as well. It's a great exercise and definitely helps with scar tissue. It helps with some lengthening to a certain degree. Obviously, the more often you practice, the better the result. But perfectly okay. Basically, kind of a rolling movement, stretching the penis out.
Oh. Do you have any procedures for length?
That is kind of a trick question because we have what's called the P-shot, and the P-shot has been shown to increase length by about a 1/2 inch to 3/4 of an inch, but only in about 50% of the population, and we don't know which 50% that will happen. So a lot of the time we will do the P-shot with the male enhancement procedure. It just helps with repair processes, and some guys get a 1/2 inch to 3/4 of an inch in length as well, and it also helps with a little bit of girth on top of the male enhancement procedure. But male enhancement procedure actually has a lot more girth than the P-shot could ever result in.
And we can't guarantee any results with the P-shot, but we can guarantee results with the male enhancement procedure.
And we do several different types of the P-shot. The P-shot itself, by itself, we use for erectile dysfunction, and sometimes we get a little bit of extra length out of it. The P-shot now also has a couple of other additives that we can put on there. We have 50 units or 100 units of Botox, which will actually increase the erection strength of the individual on top of the platelet-rich plasma. So we have the P-shot, the P-shot 50, and the P-shot 100. The P-shot 50 will last approximately 3 months, and the P-shot 100 will last approximately 6 months.
And if you're doing it for erectile strength, I can definitely vouch for the P-shot 100. Some good stuff.
Yeah, we've practiced a lot of these things here at home, or in the office.
How soon to jelq?
Starting jelqing would be good after about 80 to 90 days. that's when 100% of that filler has turned into your own collagen, so your own living tissue, and then right after that you can start gelking to help stretch out all that new tissue.
Is there a guideline document I can give the hospital I'm doing my circumcision at?
Is there a guideline document? No. Mm-mm. We just need a normal circumcision. As long as there's not a lot of tissue buildup, everything should go very well. We have a lot of guys that'll do circumcisions here and then come straight over. So
that's the thing with the circumcisions. If you do them locally where you're at and you're not able to get to us right away, then you would have to wait about 3 weeks to do the procedure. But if you do them here in Arizona and are able to schedule your male enhancement procedure for right after your circumcision, then we can do them both on the same day.
Yeah, there's going to be too much swelling if you wait, 4 or 5 hours. So we'll wait at least 3 weeks if you're out of town, and then you can come here.
I didn't miss any. I think I got most of it. What's another one someone asked? Oh, what's a favorite vacation spot? I remember that one.
Favorite vacation spot?
Yeah.
Ours?
Mm-hmm.
Ooh. What's yours?
I would say Hawaii or Argentina.
I was going to say Argentina was
fun.
We haven't been out of the country much, only to Brazil and Argentina, and that was in one trip. And then we've been to Hawaii and the Bahamas, so we don't have a lot to compare it to, but yeah. Argentina was phenomenal.
Get to see the tango. The tango is a very sexy dance.
Yeah, it was.
Is it a laser circumcision that you perform? We don't perform circumcisions here, so it just depends on the urologist that you go to.
And a laser circumcision, in fact, I don't think we've actually run into that, to be honest.
Yeah.
All of our circumcisions that we've done are used with a horizontal mattress stitch, and they come in 2 to 3 hours after that if it's locally, and if you're getting your circumcision from out of town, I don't know all the different types of stitches that a lot of the guys show up with because they've already been healed. But laser stitch, that would be actually really interesting.
Great, yeah. No questions, but love you guys and all your content and love the work you're doing. Thank you. Thank you for all your support.
What's another one of our questions we normally get?
I have it saved on my phone, but I would have to click out of here.
Go grab it.
Well, that is my phone. I think. Go ahead.
What is the average size of most guys? Usually between 4 to 5 inches in circumference, so not across, but all the way around. If you ever want to do those measurements, you have the option of grabbing a cloth tape measure, like they use for measuring clothes, or you can take a piece of string, go around the penis. We can actually go around the penis and then actually take that piece of string and measure it against a ruler or a tape measure. That'll give you the circumference.
Of course, you pulled the monster one.
Of course, because it was the closest.
What's the cost of a treatment? So if you do one shaft and one glans, it's $8,900. But we're also doing like a flash sale where if you can come in this week or next week, we still have some openings, then we'll take an additional $500 off.
It's the first time that's ever happened. So.
Can you help with scheduling everything, meaning circumcision and procedure?
The urologist that we use has been a little bit difficult to get a hold of. Usually it's best if the patient is getting a hold of them, and then we will work around that if we have to. So we are literally working around the urologist's schedule right now. But we're trying to find somebody that is temporary that we can actually have in house. So that hasn't been set up just yet.
We're working on it though, just so that way things are a little bit more streamlined. I'm from South Africa. Hopefully I get to schedule later in the year. Oh, we would love to have you.
Mm-hmm. I love it. We're reaching way out there.
Heck yeah. We have some from South Africa. We have a lot of guys from Australia reaching out. And I think we had someone from Sweden. But apparently it's hard to get into the U.S. because they require vaccination. So if you're not vaccinated, I don't know. I think he had to get vaccinated for it.
He didn't like that.
He needed to get vaccinated and then also get circumcised. One of the questions was if it was going to be like not natural looking and like deformed and lumpy.
No, usually the lumpiness comes from people that are doing fat transfers. That fat has a tendency to dissipate, especially if people start to diet. It ends up becoming uneven. What we use is a filler that turns into your own collagen. So collagen, even if you lose weight, it's not going to deform. It's like your nose or your ears. You're not going to see any type of pitting or anything that's rough looking.
Yeah.
It should be very, very natural. We always shoot for what the penis looks like in the erect state because everybody retracts at different rates. We can't control any of that, but everything looks very natural.
As long as you follow our post-procedure guidelines is the big thing, because you'll be in an advanced wrap for about a month. But we'll follow up with you. You'll send in pictures every 3 days without the wrap on so we can see how you're healing, and then with the wrap on, that way we can make sure that it's on correctly. But it's really easy to fix. Like the first 30 days is
very malleable.
Very malleable.
That filler is still very movable. So if we have anything that's out of place, we can put pressure pads to even it out very well.
Yeah.
Worst case scenario, you were sleeping at night, you undid a portion of the wrap, and maybe you were sleeping on the penis. We can still get that to level out very easily.
As long as you stay in contact with us, we can nip it in the bud.
Yep, there's a guarantee of at least 3/4 of an inch, and as long as you are sending in pictures every 3 days so we can see what's going on, make sure that the skin quality looks good, any type of lumps, bumps, bruises, we can actually get that filler to flatten out really well. And so far, most of our guys get usually about 1 inch to 1.25 inches roughly out of most of the procedures, but the guarantee is 3/4 of an inch. So 1.5 inches out of 2 procedures is the guarantee.
Someone said we need to talk. Uh-oh. Am I in trouble? Send us a message if you want to talk. I'm of Indian descent, so I gotta compete with Viking descendants and Native African men. Gonna need all the help I can get. Take it easy, guys.
Oh, we can definitely take care of your hair. It'll make a significant difference.
Oh, I'm sorry. I think I missed your answer to the ED correction procedure. How much more is that with the regular procedure?
So that depends on how severe the erectile dysfunction is. If it's just a little bit, it can be just the P shot. If you have severe ED, and we go through several different things. We make sure that your hormones are correct. We make sure that the erectile tissue is much more receptive. We can use 1 P shot all the way up to 3 different types of P shots. And every 6 to 8 weeks, it really depends on the individual. If they have comorbidities such as diabetes, hypertension, if we have to combat some of those things, obviously it's going to take a little bit more to correct those. So it is very individual based.
This guy says he needs a reduction.
Yeah, that's a whole nother issue as well. Can you go too large? The answer is yes. We were going to do a separate little podcast about this. This one definitely hits home a little bit more. Can you go too large? And Yes, usually about 8 inches is getting really uncomfortable for the female. We've been in this scenario and literally just had a reduction ourselves. So that can be a lot more invasive, and if that's what we need to do, then we can definitely send you in the right direction to be able to do that, because that is definitely surgery.
Yes. But the cool thing about it, because I got to watch it, because we know that the filler turns into your own collagen, but when they do the reduction and you see them cut open the penis to take out some of that size, you can actually see, like, the first layer is just this beautiful collagen that was formed. So it was actually really cool to see.
Brand new white tissue with new arterial pathways, new little venous structures, new little nerve endings, and those nerve endings are super sensitive. So you don't have to worry about our procedure actually taking away feeling. Actually, you'll have the same amount of feeling, if not more, in some circumstances.
Welcome. He said thank you.
Of course.
How many procedures can you do in total on one person?
The maximum has been 5. Most guys are somewhere between 4 to 5 inches. And I would say kind of the sweet spot for most females is about 7 inches around. So usually that takes anywhere between 1 to 3 procedures, but for the most part, I would say 80% is either between 1 or 2 procedures. You got to wait at least 40 days between procedures, so if you need to go 2 inches bigger in circumference, then it'll take you about 80 days total for recovery.
Are the measurements taken erect or flaccid?
The measurements are taken in the flaccid state, so if you start at 4.5, after the procedure, we guarantee there's going to be at least 5.25, but it's probably going to be closer to about 5.5.
We've taken a lot of the supplements and things that our biggest gainers have done and added that to our diet protocol for you guys to follow after, so that way you guys can get as much gains as possible too.
Yeah, we guarantee 0.75 inches, 3/4 of an inch, but one of our guys ended up with 1.75 inches out of one procedure, and it was because of diet protocol, it was because of genetics. Everything just worked out really well for him. It wasn't that we added any more filler, it was literally just because of what he was eating and how well he was doing the wraps, was sending in pictures every 3 days. We were able to really work with everything. He was doing a little bit of peptides and definitely all of the nutrition recommendations. So the body can definitely help with the procedure itself.
And usually when you come out of the procedure, you'll be like almost 2 inches bigger than what you came in with, just because there's lidocaine and there's swelling. So a lot of guys will they'll see the size potential when they walk out, and then it makes them want to have another one.
Yep, this one's 4.5 inches around. This one's 5.5 inches around. This one's 6 inches around. When you come out, you're going to be closer to this one. But over 30 days' time, you're going to go back off about an inch and end up being about that. After about 40 days, you'll end up looking really close to that. But they usually get to see what they look like 2 inches bigger. So a lot of guys will end up doing a second procedure to get back up to where they were when they first left. So definitely a significant difference between all of them. Definitely a lot more volume, and it definitely stimulates the vaginal canal, especially those first 2 to 3 inches where most of those nerve endings are sitting.
Infamous girth models.
Yep. What else do we got?
I should have gave you the questions so we could pull them up on your phone and not my phone.
I can't think of anything right now.
And if you're local, you also have the option of coming back to the office during your recovery period and having us do the wraps. which every guy that has been local here has opted for. Because if you want to do the wraps like perfectly, it usually will take like 3 hands.
Yeah.
So if you have someone helping you, you'll get the best. It's doable if you only do it yourself, but it makes it much easier when you have an extra set of hands.
Yeah. What are some other questions? Do you have to be circumcised? We definitely recommend guys get circumcised before doing this procedure. The reason being is because if you're not circumcised, the foreskin that's up and around this area is much thinner, and if you put filler up in this area, it will bulge. So we can't put any filler up and around this area. So with that being said, if that happens, we actually have to almost make it in a bottleneck, and then there's no filler right through this area right before the glands. So we definitely recommend guys get circumcised beforehand. If not, and we did the filler, could you have a circumcision later and take out this portion and pull it forward? Yes. Do the results come out as good? Definitely not. So we definitely like to see our guys circumcised before getting in here. And we don't have anything against uncircumcised guys. It's just the procedure itself doesn't turn out nearly as well. Not only that, but some of the circumcisions are covered, and a lot of them are covered under people's insurance. Mm-hmm. And they can get it covered because then it's a reduction in risk for STDs, so that's the reason you give.
It's a little tips and tricks right there. Pain. Well, we talked about how we do like the topical numbing, the numbing injections. We offer Pronox. But as far as pain, that's probably one of the most surprising things that guys will walk out of here saying that they didn't have any pain after. And any pain during the procedure, they'll usually report back like a 1 or 2 out of 10, and that's mostly when I'm hitting them with the numbing injections. So that's when I always say I'm the good cop and the bad cop. You'll feel my shots, but eventually you'll be completely numb.
Yeah, but she does a great job. Very little pain whatsoever. Do you have pain after the procedure? Most guys report having no pain whatsoever. Definitely bruised, but other than that, perfectly normal. Yeah. And no keloids are formed either.
We don't use any scalpels or do any cutting. You won't have any scarring. So, no evidence.
Yeah. We compare it something very similar to doing female lips. And inside female lips, when you're actually adding filler, you can have arterial occlusion. But because of the filler that's being used, that is not one of our concerns. With our type of filler, actually, there's no type of arterial occlusion that can happen. So we have very, very minimal risk. It's less than actually doing a female's lips, to be honest.
Very safe and effective. And proven. It's probably been over like, can I say 17?
More than 10,000.
More than 10,000 guys.
It's been used for 15 years now.
Mm-hmm.
So actually a dermatologist came up with the type of filler that we're using. And it's limited to his people. And we are the only, I believe we are the only ones in Arizona right now.
Yeah. So we don't use like hyaluronic acid fillers. So most of the time, like all of the other clinics that offer male enhancements will use temporary fillers, and they're limited on the amount that they can put in. So they'll usually put in between like 10 to 20, or no,
10 to 15.
10 to 15 cc's. But
because each cc is roughly about $500 or $600 that they have to buy it. The amount of cc's that we're using is anywhere between 50 to 75, depending on length and girth of the penis that we're actually working with. Yeah,
so we're not necessarily as limited as they are. We'll basically put put in as much as we can that your body can hold.
Yeah, you're either stuck with something that's temporary and never going to become you, or something that's going to turn into your own collagen with new living flesh. So to me, it's kind of a no-brainer.
Yep. So if the finances are ever a concern, to kind of do like the pros and cons of each one. Temporary suck, I know from experience, definitely looking for it to wear off.
Wonderful. We can't wait to see you.
Yeah.
And if you ever want it to wear off quicker, we can always use Hyaluronic Ace, which will take care of a lot of that a lot quicker.
Mm-hmm.
So
we got you.
we come across quite a few different scenarios, so we're able to take care of some other people's.
Yep. We've had guys that have come in that have used temporaries. We've had guys that have used, or they have implants put in. We've had guys that have implants put in and then taken out. Well, I think the one that had the implant in was more for erectile dysfunction.
Yeah.
Or prostate cancer. One of those two. Which, if you do have a penile implant in, we can do the procedure still.
Yep.
And he got good results from it. The guy that we had, he had the implant put in and actually lost quite a bit of size. He lost like 1.5 inches in length and I think 1 inch in girth because of that implant. So
yeah, definitely think about doing implants. Definitely take a step back and think about that before, if all you're looking for is size. And if you're planning on doing erectile dysfunction stuff and you're thinking about doing implants, definitely take a few moments to think about that. Is it going to take a little bit of time to do the P shot? If you have to do 2 or 3, yes, but I truly believe you're going to be a much, much happier person. What other normal questions we get? So we can do the shaft, the glands, and the scrotum. The shaft is the fastest growing out of them all. The glands, the head of the penis, grows at about 30%, 30 to 35% of what the shaft does. So some people want a huge old head and a huge shaft. And that is usually most males. Most females want more of a tapered head that goes into more of a solid base. If you're going to be doing several different enlargement procedures, you're going to try to want to keep the glands somewhat up to the shaft, not necessarily all the way up to the shaft. So we recommend doing 1 glands and 1 shaft procedure because you're never going to get the head as big as the shaft unless you're doing 5 or 6 different glands procedures.
and then we do the scrotum as well, which I don't think I've done like any videos just on the scrotum.
Nope, we've done several guys that do the scrotum. The scrotum.
Yeah, we like doing those.
Yeah, we actually do. We actually add more filler in the scrotum than we do anywhere else. Now, we don't add it into the actual testicle sac. We actually do the dermal and subdermal layers of it. And the reason being is because the testicles will actually push up the penis more, giving it more of an illusion that the penis is longer. So it'll support, but it also will have extra weight around this area. And when you're in doggy style, that penetration will actually have the testicles hit the clitoris a lot harder. So we do doo-doo. Yeah, we're kind of geeks. We're kind of trying to tone it down, but
easily amused. Sorry.
Doo-doo.
I cut you off. What do we do?
I don't know.
We do the enhancement.
Yeah. It just gives the scrotum a lot more weight.
Yeah. So a lot of guys will do it either because it is more pleasurable in certain positions, or if they're on testosterone replacement therapy, it does have the tendency to cause atrophy to the testicles. So we can
Add filler
to the sac, and so it at least gives the illusion that it's bigger. And then some guys just kind of see it as just, bigger sac is more manly, so they just feel more confident with it.
There's a lot of psychological that goes along with aesthetics.
Yeah. But that one's a fun one. We can put quite a bit of filler in that, so we always like doing that.
Yeah, and we can do scrotum, glands, shaft all at the same time.
Yep. So if you do one treatment of the shaft and one treatment of the glands and one treatment of the scrotum, then it's $14,950.
Yeah, if you're doing them all together.
All three together. This guy says, I just want a 12-incher.
Well, usually that is pertaining to somebody in length. So 12 inches would literally be almost the size of a paint can.
Oh, in girth?
Mm-hmm.
Yeah. You would be very limited on who you can be with at that point. We were concerned about our 10-incher, so I can't imagine a 12-incher.
It'd be more like, it would be bigger than a horse.
That would be bigger than a horse.
Mm-hmm.
You could get one of those horse toys and try it out on your partner and see if they can take it, because they do have those. No, he says you guys are great. Definitely don't tone it down. How long does treatment last?
The male enhancement?
I think. Are you talking about the male enhancement treatment? I don't know if there's
Male enhancement procedure from the time that they come in till recovery, at least 90 days in total. But before you can have sex is at day 40. But only about 20% of our guys make it to day 40.
Yeah.
What can happen is that after we put filler all the way around the penis, if you have sex, you can take about 10 to 15% of that and push it towards the pubic bone and misplace it. So we recommend not having sex for 40 days. Most of it's set up after about day 25, so definitely try to hold on till day 40 if you can.
Most of the collagen's set up, and then we have you wear a basic wrap up until day 90, because there's still the remaining 5 to 10% of collagen that can still be made up until then. So we want to try to keep it in a cylindrical form.
Oh, that's what he meant.
Oh, I mean, must I redo the treatment? No, not with us.
So those types of treatments that it says, I must redo the treatment once every 2 years, ? No, you do not have to redo the treatment. This is a permanent type of filler. We do not use any type of hyaluronic acid. Hyaluronic acid will always remain a foreign substance to the body, so it's always attacking it. It's going to start to degrade after 2 to 4 years. What we use is a type of filler, which most of it is an organic type of compound that literally turns into your own living collagen with new arterial pathways, new venous structures, new nerve endings. If you were to cut open the penis, you would actually see new living flesh made of you. And so your body's not going to attack something that is you. So you don't have to get touched up every 2 to 4 years like the others. It is a permanent type of filler.
I just saw someone here that I want to be the coochie destroyer. I feel like every guy does.
There's goods and bads to that.
Yeah.
We'll have to do another podcast.
Yeah, I know. I'm setting up our new podcast room, so we'll be able to do more of these. Which I'm excited. I want to come there, no lie. I need to get my money up. We'll be here when you're ready.
Of course.
And if you need our financing options, just send us a message and I'll send you the links to see if you qualify. I work construction. How much time do I need before I can return to work?
That depends on the individual. Some guys, I have a lot of construction guys, electricians, they're climbing up ladders. The biggest thing is bending over. We don't want the hips to disengage and pull back. What?
I just saw Brandon's comment, sorry.
Oh, we don't want people pulling back in the hips. So if you're sitting in a chair, we don't want you sitting at a 90-degree angle. We basically want you sitting to where you scoot your butt towards the front of the seat and lean back in that very relaxed position. No bending at the waist, so no doing any of this. Okay? If you go to pick something up, literally go down to one knee and then grab it, because it's going to lock in the pelvis. So is it doable being a construction worker? Yes, you can still pull it off. You just have to go slow and pay attention to your posture. We don't want you to pull the penis inside of the wrap. Otherwise, you're going to have to undo the wrap, pull the penis forward, and wrap again. Which it will happen. Mm-hmm. A lot of guys, there's showers and growers, and the ones that have a tendency to retract really hard, and they definitely have to fight that retraction a lot more.
So they'll have to adjust the wrap.
With that being said, there is the P shot with the 100 units of Botox. We can add that in there, and it will take about 5 to 7 days for that Botox to kick into the muscles inside of the penis, but it will help keep the penis pulled forward. So it's basically paralyzing the muscles that usually retract really hard.
And we've done that with a few guys lately, where they are definitely growers, and we'll do the Botox or the P shot with the Botox, and they don't retract near as much, and they're able to stay out more.
Yeah, so there's some guys that'll have just the very head pulled all the way back into the pubic bone area, and that's all you can see. But after actually doing that shot, they'll have 4 or 5 inches that they're actually just completely out of there, and it'll stay that way for approximately 5 to 6 months.
And the results turn out really well when we're able to do that.
Yeah, because you don't have to worry about that fighting retraction coming back inside of the wrap.
Brandon says, "Fill me up, Steve."
I've been waiting. Let's go, Brandon.
You know where the procedure room is.
And Brandon's our guy in front, so.
Yeah. So if you call and you talk to him, that's who it is.
Yeah, Brandon and Autumn are both great people to talk to, so.
Yeah. And I'm trying to get them to do a video, so that way all of us are in one. So if you guys want to help me out with getting them to do a little dance video. Hi. Have you done the procedure?
I have done the procedure. I've done it twice. Actually 3 times.
I was going to say that.
So the third time was a mistake. Having a little bit too much can be very damaging to a female as well, and you never want them to be uncomfortable. So getting a reduction is much more invasive, and the reduction can be brutal. So definitely try to zero in on what she wants, and usually it's roughly around 7 inches. But there are certain vaginal canals that are larger than others. There are definitely certain races that have larger vaginal canals, deeper vaginal canals, and that 8 inches might be suited for her. You can definitely use different types of toys, measure them around, and see what she likes before going too big.
And we actually went to the adult store like a month ago to try and see if we can get different toys that have different girth sizes, and a lot of the dildos that are out there are more focused on length. Yeah. And so most of them are around like 6 inches around and 6 1/4 around. So if you're wanting to go bigger than that, it's a little limiting as far as toys for girth.
You can find them though.
They are out there.
Bigger section size. You just need to take a tape measure with you.
Yes.
Measure them.
You do have to take a tape measure, and then, but most of like the bigger sizes are in like the extreme kinky.
You can definitely tell that a lot of the dildos are being made by guys, because Guys usually think of being large as length, and usually females think of a large penis as being really wide in girth. And that's because we are visual creatures. Females are usually more sensual creatures and more about feeling. So. What else we got? Can we do Botox to the penis? So that's called scrotox.
To the scrotum.
To the scrotum. The scrotum in certain individuals can pull really tight and actually almost squish the testicles. If you do Botox to the sac itself, it will relax those muscles to where you actually have more room. And that should last roughly about 6 months if you're using about 100 units of Botox as well.
Scrotox. Is that what it's called?
Mm-hmm.
Scrotox.
And then the Botox is literally putting Botox into the penis.
Yeah, and that's just Botox.
Yeah, Botox straight into the corpus cavernosum, which will help elongate the penis in the flaccid state. What else we got?
We can save it for next time. We've been on here for about 45 minutes.
Oh, have we?
I know.
All
yeah.
right. All right.
That went by really fast.
Yeah, I did.
Well, this was fun. We'll probably do more.
Yeah, if you guys have any other questions, we'll definitely answer them next time around. Maybe we'll try to get some of our friends to jump on one of these as well. That will be out of Canada, hopefully.
Yeah. And I'll try to give people more advance notice of the live rather than just an hour. But it was kind of a spur of the moment. Let's try it out for the first time type thing. So
Worked out well. I
yeah.
think.
We popped our live virginity. Our cherry.
This is what I got to work with.
Well, thanks for joining us. We'll do
All right,
this
guys.
again. So come up with more questions and we'll hop on here and answer them.
All right, we'll see you later.
Bye.
Bye-bye.